morning. It's a Saturday. Today is, what date is today? Yeah? So we tend to forget the dates as well because it's the third week of our MCO. So now one of the activities we want to do is to do educational webinars. So I hope I can educate our women folks out there to learn more about any topics that would be of interest. So today we're going to talk about our first webinar. We're going to talk about urinary incontinence, which is a very common problem. What, why, and how to tackle this. Okay. Now we all know as women, just like men, we age too. And as we age, our features change and our bodies change. And slowly over the years, aging takes over. We are born, we turn into a teenager, we grow into adult female, and then slowly we get into an older female. At the age of 20, many of us feel very great about ourselves because our estrogen, our progesterone, our testosterone, and all the other hormones in our body is at their peak. So everything is at the best. You know the saying, they say youth is always wasted on the young because you don't feel the lack of any of these things yet. By the age of 30, now aging starts around the age of 28. And by the age of 30, our metabolism starts to slow down, our fertility decreases, hormone production declines. But for a lot of people, this is not really felt that much yet until a little bit later in the late 30s and going into the 40s, whereby the libido will start to decline, the mood starts to swing, there is muscle loss, and there is weight gain. Many women at this point in time, from early to mid 40s, begin to complain a lot about their weight gain and the difficulty in losing weight. And this is really due to the shift in the hormone levels in the body. Hormones have declined by now to the point of actually being deficient. Now, studies have shown that our hormones reduce 10% per decade of life, which means by the age of 40, we have about half of what's available when we were at 20. So it is not surprising that we start to get illnesses, metabolic disorders, start to feel not as energetic and as well as we used to in our 20s and 30s. Now by 50, menopause would have set in. There would be low energy levels, there would be more feelings of fatigue, there's more weight gain, and there's sometimes even memory loss or just difficulty in remembering things. And this is really due to major reduction in the hormones. Okay, and so what is urinary? Now with all that into place, we're going to talk about urinary incontinence and how does that work into urinary incontinence. So urinary incontinence is an involuntary leakage of urine, meaning you do not want to pee, but there's urine coming out. This means a person urinates when they do not want to, and there is difficulty in control over the urinary sphincter, either lost or weakened. So incontinence of the bladder occurs when the pelvic muscles that is involved in urination is either traumatized or overstretched, and this leads to weakening of the muscles. Now, these muscles become weak until at a certain point, it cannot support the bladder anymore. And when therefore, because it cannot support the bladder, when there is high pressure from inside the abdomen, such as when you cough, you sneeze, or you lift something, or you push something, the bladder then forces the urine past the urethral sphincter, which is the outlet of the urinary tube, to cause urination or incontinence. I will show you a diagram of this later, okay? So do you know that there are every 2 out of 3 women has urinary incontinence? It is such a common problem that many women take this for granted and accept this as part and parcel of aging process. It is so common that it is accepted as part of their lifestyle. Even though it affects their lifestyle, it affects the way they move about and in terms of their quality of life, right? So we do not have to suffer anymore. We need to educate ourselves and then learn and understand what it is, how it happens, and what we can do about it. Now, some women have very rare urinary incontinence. Some don't have any at all. The majority, about half of women don't have any incontinence. The other half would have a frequency that varies, majority of which between 30 to 35% and 35% would have at least once a month or at least once a year. The rest, some would have at least once a week, about 18% of women, very rarely about 12%, and about 7 to 8% of women would actually have at least once a day of leaking. Yeah. Now, there are 4 main types of urinary incontinence. There's stress incontinence. This is due to poor closure of the bladder outlet. There's urge incontinence due to the inability to hold the urine flow. There's mixed incontinence, the presence of both conditions. That means a person has both stress and urge incontinence. And then there's flow incontinence due to the bladder contraction or blockage of the urethra. Let's go through them one by one. This is a diagram of the 3 types of incontinence to make you understand better. The first one is stress, where there's very little tone, and so the urine it's not strong enough to hold the urine. So when there's increased pressure, the urine flows out. Urge means there is too much activity in the bladder, pundi kencing, and therefore every now and then there's an urge to urinate, and when you want to urinate, it cannot be held back. You need to go and pass urine. Overflow is when the bladder is full, you're unable to hold it back, and so the urine flows out. So what is considered urinary incontinence? For stress continence, it is only when there's leakage of urine, when you laugh, cough, sneeze, lifting heavy objects, when there's vigorous exercise like running, marathon, yoga, sometimes during sexual intercourse, and many times during standing for long periods. Some of my patients tell me, they're waiting at the airport during the queue, and because of the long queue, then incontinence occur. Yeah, urge incontinence, on the other hand, is actually frequent urination. So in a day and at nighttime, you would feel you want to urine, like you pass a little bit and then you want to go again. And then when you go, you need to go really fast. When the sensation comes in, you need to have it done. Otherwise, you will actually leak. So it can happen during the day, it can happen during the night. There is, these women usually complain that when they go shopping in a big shopping mall, and suddenly they feel like passing urine, but then they cannot make it to the toilet, and so what happens is they leak. So this is urge incontinence. Overflow, as I told you, it is when the bladder is full. So when it's full, you need to go and pee or urinate, otherwise there'll be dribbling of urine. Okay, so what causes incontinence? Of course, one of the main cause is aging. Just like our skin, which slows down, which becomes thin due to the process of aging. It becomes thinner and there's more wrinkles. The same thing happens to the vagina wall, right? And then when it hits menopause and the hormones go down, this is due to estrogen, the condition gets worse. So estrogen goes down, which is, it is the female sex hormone. And this is very important. Estrogen is very important for our repair process, the maintenance of our reproductive tissues, and the thickening and thickness of the area in the vagina, which supports the bladder and the urethra. As we age, the estrogen declines, and so we go into perimenopause, and then it occurs in the 30s, and then to menopause. Okay, with low levels of estrogen, there are many other health issues that women face, among them stroke, heart disease, osteoporosis, and also the vagina has a lesser secretion of natural lubricants, which causes it to be dry and itchy. The thinning of the walls then become less elastic. further contributing to vaginal looseness, and this affects the urethra or bladder wall. Okay, so this is a diagram to show you symptoms of menopause. As you can see, there are many different things that's occurring. The more important one would be frequent urination, and really relevant to what we're talking about today. And do you know that about 50% of women after menopause would suffer from stress urinary incontinence? And among these 50%, 80% would actually have vaginal atrophy. It is actually very common. So vaginal atrophy, I'm sure you've heard of it before, is the thinning, drying, and inflammation of the vaginal walls. And this is due to menopause. And for many women, this vaginal atrophy causes a painful intercourse, but also very distressing urinary symptoms. See this vaginal wall thickness in your 20s, and in the 40s, it's gone down by almost half. So this is just to impress upon you how thin the vaginal mucosa becomes once menopause has occurred. Okay, so what happens? You get vaginal dryness, you get vaginal burning sensation, some vaginal discharge, itching in the genital area, burning sensation when you urinate, urgency with urination, more frequent urinary tract infections, there's urinary incontinence, sometimes even some light bleeding after intercourse, definitely discomfort with intercourse, and many couples do not want to go through intercourse because of this. And because of the reduced vaginal lubrication, the sexual activity becomes less and shorter. The shortening of the tightening of the vaginal canal also makes whole activity worse. Okay, so this is a diagram. I just want to show you, these are the three important structures in the pelvic cavity. The frontmost is the bladder with the urethra, which is the tubing for the outlet of the urine. Behind it is the uterus as well as the vagina. As you can see, the bladder and the urethra rests on the front wall of the vagina. So if your vagina wall is lax or is weak, then the angle of the bladder and the urethra will actually change. The vagina and the uterus rest on the lower part of the rectum. Outlet is the anus. So the muscles between the lower part of the rectum and the vagina, there is a muscle called pubococcygeal muscle, which form the pelvic floor muscle. This is the muscle that we use to tighten, strengthen, and support our pelvic organs. Okay, so this is another view from below. So you can see there are three holes, in case you do not know. The urethra opening, which goes to the bladder, the vaginal opening, which goes to the uterus, and the anal opening, which goes to the rectum. Okay, we've gone through that. Other contributing factors to stress urinary incontinence, actually, I want to say that stress urinary incontinence is the most common in public out there without any other medical or surgical problem. And it's usually due to pregnancy, childbirth, aging, obesity, menopause, and surgical procedures. So childbirth is one of the reasons why women get incontinence early onset, if it is not, especially in the younger women. Usually, this is due to the damage of the pelvic floor muscles or the sphincter that occur during a normal vaginal delivery. Usually, this is experienced if the baby is big, or if the delivery is prolonged, or there's quite a bit of trauma in that area. Other factors that causes incontinence could be conditions or illnesses where there's chronic coughing or sneezing, people with allergies, people with rhinitis, they continuously sneeze and have cough, bronchitis. So this could cause incontinence. Obesity, the heavier you are, the higher the chance of stress urinary incontinence. Smoking also causes, can precipitate, can aggravate. Of course, high impact activities like jumping and horse riding and running. What do we do? Investigations that we can do would be some physical examination. That means you come and see me, and then we examine and just to make sure that there is no muscle or pelvic floor prolapse. If there's a uterine prolapse, then a surgical intervention is required, and we need to do other things. If there's nothing else going on there, then it's a physiological condition, we can proceed with treatment. We do urine culture in situ just to make sure that you're not having infections, but this is usually easily identified in your history. If you have frequent infection, if you have infection, you can have frequent urinary passing of urine. We do a pad test, or I ask you about a pad test. That means, do you wear a pad, and how does the pad get soaked? Is it a panty liner, or is it a full sanitary pad? And then I will ask you to monitor this when you go home, and you can give a feedback as to how much leaking you have. There's a way to measure post-voidal residual urine, where there's an ultrasound is used to actually look at your full bladder, and then after that you pass urine and we check your bladder again to see what is it. But this is normally not for stress urinary incontinence. This is for the other types of incontinence where we suspect there could be some other obstructive disorder there. So then we go on to uroflowmeter, urine flowmetry, and cystogram, and so on. Medication, there are a few medications out there. These are called anticholinergics. You take them orally. It helps to reduce the sensitivity and activity of the bladder. Sometimes the gynaes will give topical estrogen, either inserted or used. Sometimes we use some medical device, and surgery is an option. Okay, let me just go through this a little bit. Medication to relax the bladder muscles and increase the amount of urine that it can hold. Among the medications that's used, they are usually actually meant for vaginal atrophy. But so they don't help that much with incontinence, but they use them because both conditions sometimes occur together. So there's the vaginal moisturizers, the use of water-based lubricants, and the topical vaginal estrogen. Now, rejuvenation, non-surgical, is done through laser treatments and radio frequencies, which results in a tightening of the vaginal walls. There could be used vagina fillers and threads, which is also becoming common now. This helps with creating a tightening effect. Of course, you should do pelvic floor physio exercises. Yeah. Surgery would mean either hymenoplasty, surgery is out. So pelvic floor exercises, mainly Kegel exercises, this strengthens the pelvic floor muscles. This is something you can do your own at home. Do it regularly, frequently. One of the ways that I advise patients is when they go to urinate in the toilet, what you can do is you pass urine and then you hold your muscles together to stop the urine flow, count to 20, and then release the urine. And do this 2 or 3 times. Once you do this often enough, you begin to learn to identify the muscles that hold, which is the pubococcygeal muscle that hold your bladder. And you can do this every day, all day long. You can do this when you're watching TV, when you are driving home in the traffic jam, when you're sitting at your office table. This will help to strengthen the pelvic floor muscles. Now, fluid consumption, it's not highly recommended because really you do need to drink that amount of water, but naturally during work time and all that, when it's difficult, or when you're traveling, when you're on holiday, when you are flying, you may need to hold back the fluids, because otherwise you're going to have to look for a toilet every time. So all these are lifestyle changes that has to be taken into consideration. This is just to show you how vaginal laxity can affect the bladder and urinary flow. Lifestyle, do the daily pelvic floor exercises, quit smoking. You must make sure you do the right exercises. Avoid lifting heavy objects. So what our mothers used to tell us, you know, young ladies, don't lift or carry heavy objects. That's very true. Get the men to do it. Even if you do have to lift, if there's no men around, you must learn how to lift it well enough whereby you do not put all the pressure onto the bottom half of the body, okay? Because you don't want to apply this unnecessary pressure and weight. Fight the incontinence by losing weight, try to lose weight, and then strengthen the muscles in that area. Try not to have constipation, treat your constipation properly, and cut down on caffeine. Okay, here's a look at some of the procedures that we have. Apart from what you can do at home, apart from the medication you can take, which works quite okay, and then apart from surgery, there really was nothing available out there to treat urinary incontinence, especially stress incontinence. It was like hair loss in men. You know, you accept it as part of aging and you just accept it. Even if it occurs in a young man, you just have to accept it as part of it. But for stress urinary incontinence, or SUI, if you didn't have if the medications didn't work and you're not bad enough to need surgery or you don't want surgery, there really was nothing in between. So there was a need for the majority of women, and that's about 50% of women out there, for treatment that was non-invasive, the non-surgical, no cutting, not needing surgery, but was effective. And so the lasers, the technological advancements like lasers and radio frequency and ultrasound came about. Now, what does it do? Basically, the lasers strengthen the vaginal wall to straighten it, shorten it, and therefore allow it to rest better. Okay, the lasers that we have 3 treatments that's available with us, all are FDA approved. One of them is called Incontinence, which is the main laser treatment for incontinence. Absolutely many clinical papers and data are available to show how good it works. So it is for stress incontinence. It is an erbium YAG laser to treat mild and moderate urinary incontinence. But having said that, they have had a recent approval for use for severe incontinence and even for prolapse. And in fact, I have a patient who actually came with prolapse stage 3, needing surgery, and she asked me if she didn't want surgery, so she asked if she could undergo this when she read about it, so that it could try. I didn't promise her anything. I said, well, let's just give it a try. If it helps you and it works, well and good. If it doesn't, then we just have to go for surgery. So we said, okay, let's do this. Usually we recommend 3 sessions, but in this time I recommended 5. Initially, the first 1 and 2, she found not much difference. And then after the 3rd, she was very happy. So she called in, and since then she's only on maintenance annually. So this laser actually stimulates collagen and causes shrinking of the vaginal wall and then tightening of the vaginal mucosa. Okay, this is how it happens. We put the handpiece is inserted into the vaginal area. Once it's inserted, the laser light is short. There is thermal stimulation, feels a little bit hot. And then after the treatment, there'll be some thermal injuries, but the collagen will then regenerate. Now, some patients ask me, how does this help with the bladder and the urinary outlet when it is inserted into the vaginal wall? So if the vaginal wall is actually thin due to aging and menopause, then the urinary outlet would also be thin. There is a treatment that you can put a probe into the urinary outlet, but it's too thin and it's very uncomfortable. And we know that the angle of the bladder changes because of the weakening of the vaginal wall. So by strengthening it, yeah, this helps and thickening the wall. You can see after the laser, the membrane of the vaginal wall becomes thicker. This then changes the angle of the urinary outlet, right? So from 80 degree to about 60 degree, which makes it not too easy to leak. Okay, so Incontinence is a treatment that's painless. It improves the connective tissue in the area, and about 85% of the treated women will no longer suffer from incontinence. This is a video. I can't play the video. Now, the second treatment that we have is called Viviv, which is actually a radio frequency technology. that also helps to increase the collagen, treat vaginal laxity, reduce urinary incontinence, and the best part is even improve vaginal lubrication and enhance sexual sensation. Slightly different in the method of treatment because it uses radio frequency. Is the one and only device in the whole world that uses radio frequency. If any of you know Thermage, which is the radio frequency technology to tighten skin, Vivif is by the creators of Thermage. Okay, so this is non-surgical. It used to be mainly for vaginal laxity, and then now it's used for urinary incontinence as well. All right, so it is the probe. This is how the handpiece looks like. The probe is inserted into the opening of the vagina, and then radio frequency heating occurs, and that causes the tightening. There's a longer probe now created that goes in and is only used deeper into the vagina, but on the front wall where the urinary outlet rests. So by doing this, it thickens the front wall of the vagina, and the heat goes far enough to the urinary tube, and that also actually creates collagen and firming and strengthening of the urethra. Okay, see this? The heat goes in. So benefits would be, these are all outpatient procedure. They're safe, they're easy to do, easy to conduct. You don't have to prepare yourself for anything, just make an appointment. First appointment to see me or to see any of our doctors to analyze, assess, and make sure that you are an ideal candidate. If you're not, you need a referral. If you need surgery, then you'll have a referral to the gynecologist. If you don't have such a problem, then I may recommend you some oral or topical treatment. If it's hormones, then we may undergo some bioidentical hormone therapies. But if you are the right candidate, then we will arrange another day for you to come, preferably if you have menses, not when you have your menses, 2 weeks after your menses. Come in, everything's ready, and then we proceed with the treatment. So it's quite easy, it's safe, and it is quite effective. The results are almost immediate, usually takes about 2 weeks later, and you can almost feel the difference. Some people may take slightly longer, but usually around 2 weeks. It is considered minimally invasive. In fact, it's not really invasive, but because it goes into your body, so it's called minimally invasive. Everything is single use. We discard the probe after using. In the case of the laser, we actually have a special cover, and this is sterilized and autoclaved each time. So everything is sterilized and properly done. So please make sure whatever you do, this is in our intimate area, do it in a proper place and by proper people, because I have heard of stories of people doing it and having all sorts of infections later. It's always single use, okay? And these are all clinically proven. So we don't have to worry each time we laugh, cough, or sneeze anymore. These are the treatments available. It's easy and effective. And you shouldn't let bladder leakage hold you back. Thank you. Any questions from anyone? I have one question here. Can incontinence come and go, or does it last forever? The answer to that is yes and no. It can come, like I showed in the one of the earlier slides. Some people have it once a year, some people have once a month, some people have even every day. So whatever it is, we know that it can occur and occur at any age, usually as early 30s. And it gets worse as time goes on, because initially it could just be the weakening of the muscles, but later on it could, the hormonal changes, the weakening of the muscle, the skin, the collagen reduction, all these then contribute to worsening of the situation. So it will occur, it will get worse as you get older, as if you don't do anything about it. It is unlikely that it occurs and then it disappears later because aging continues. The process and changes that occur in aging continues. We do not get stronger as we get older. We do, well, some people do, but then most of us don't, and it doesn't get hormones do not get more as we get older, right? And anyway, if the damage has occurred at childbirth, you can't very well do much. You can reduce the damage and strengthen the muscles by doing all the Kegel exercises, okay? Does it last forever? In a way, yes, unless you do something about it. Okay, another question, does pregnancy leave a lasting problem with urinary incontinence? Does pregnancy leave a lasting problem with urinary? Pregnancy can cause urinary incontinence, and that's because, and that's very common, but it is really due to the growing fetus, growing baby in the womb. This creates pressure onto the bladder as it grows, and so the pressure on the bladder makes you want to leak and makes you not be able to hold back. Also in pregnancy, there is increase in the hormone progesterone. This hormone progesterone causes relaxation, and one of the things it does is relaxes the bladder outlet. And when it relaxes, then it's easy for leakage to occur. So yes, pregnancy can cause incontinence, but this is pregnancy-related incontinence. After pregnancy, it is not anymore because of the increase in the pressure, but later on due to weakening of the muscles. The latest treatments, the ones I mentioned, yes, the latest treatments are actually those, why there is such a huge market and a huge publicity on these lasers for vaginal rejuvenation is that for the longest time, there was nothing to cater for this 50 to 80% of the population of women. There really was nothing. So they realized that if the face can age, if the skin all over the body can age, the vagina can age too. And then we realized that all these organs play a role. So why not we strengthen? So the advent of lasers and radio frequencies came about only about 8 to 10 years ago because of the need for this. And yes, these treatments that I mentioned, there are many in the market, but there are only a few that has had FDA approval and CE marking. The ones that I mentioned are 2 of the 3. Third one is called the Mona Lisa, which is an Italian laser machine. I didn't mention that because it's mainly for vaginal atrophy. Yes, they are the latest, and they have a lot of clinical data. There are some newer machines in the market like Amcella and Fermi Tide, I think, or Fermi V, but these are not yet FDA approved. Any other questions? Okay, I think that's it. Thank you very much for being with me this past 45 minutes, almost an hour. I hope you found it beneficial. I hope you all learned something from this talk. You have any questions, you can always call the clinic, or you can WhatsApp to these 2 numbers, 012-304-3779 or 345-3779. We can always have a session to chat. Now that it's MCO, you can stay at home in the privacy of your home, and we can have a virtual consult, and we can talk further so that can see how we can help you there. Okay, bye.